Hey, welcome back. This is the Value Analysis Program, and we're going to go into the section on leadership. So you've made it this far. You're in the home stretch. This is 7 out of 8 of these recordings for our program. And I want you to realize that even though I've put leadership, number 7 out of 8, you got to understand it's not because leadership is underappreciated or is not necessary. It's primarily because it fell into the mnemonic. That's where it was in the special PI portion of it. I just stuck with that as a way of just ordering the chapters of each one of these sections. So, anyways, if you're wondering why I put it here, that's the reason why. But leadership is important. Everybody knows. In fact, actually, I work with a guy at Banner Health, our president CEO, a guy named Peter Fine, and he used to, at every senior leadership meeting, he used to remind us leadership matters, and it really does. And I think that's the important thing about this program is that it's really going to go nowhere unless there's somebody who's providing that leadership. My guess is if you're viewing this program, you're one of those leaders. You're the person or one of the people who's responsible for putting this program together and making it successful. And so we're going to talk about leadership, and I'm not going to talk about it in terms of how most people think of it. But if you look up any book or Google it or something like that, what'll happen is you'll see leadership and you'll see, the 7 qualities of leadership or, or the 10 qualities of leadership or the 3 things that every leader must know or something like that. And I think those are all important and they're great resources, but you can find that stuff just about anywhere. What I want to do is specifically talk about leadership within a value analysis program, and particularly for those people who are starting up the program, because what you're going to find is that people have expectations of you. And if you meet those expectations, then you're considered, a superstar. If you don't meet those expectations, then you're going to be considered a failure. And it's as easy as that. And so the problem is that a lot of your program's success is going to be dependent on how other people view your success. And so you want to be able to meet those expectations, or at the very least be aware of them and be able to manage them over time. And I'm going to talk about that, and we're going to go through each stakeholder group, and we're going to talk about the types of expectations they have of you as a leader, what they're looking for specifically in you to accomplish with the value analysis program, because that's going to be an important decider whether your program is successful or not. Not only that, but over time, when people start to see that, wow, you understand what they're expecting of you, you'll be more successful down the road because now they will know that they have a person that they can count on. And that's just part of leadership too, and that is being a person who someone can count on. The other thing to remember is a lot of leadership is problem solving. I mean, that's why they put you in this position. You're going to be solving problems, and so what's going to happen is every one of these groups is going to be coming to you with a problem of some sort that's going to be related to value analysis. And so it's going to be important to understand their expectations, understand the kinds of things they're going to be bringing to you, and understand the kinds of things that others are going to be expecting of you in terms of the leadership for not just your program, but how your program impacts the organization as a whole. And so we're going to go into each of these stakeholder groups and also these expectations. And then I have a special section on succession planning towards the end of this and talk to you about why that's important as well. So first off, who are your stakeholders? Well, it's this list right here. This is the major stakeholders. It's really what the slide should say. But it's physicians, it's your administration, it's your supply chain services, it's nursing, it's your value analysis committee membership. And we're going to go through each one of these separately. And I did put one under there for succession planning because it's going to become an expectation. And when we get to that point in time, I'll explain why that's extremely important and some of the hard lessons I learned along the way in succession planning, and why you can and should avoid any of those types of issues should they arise. So let's talk about physicians. Well, first off, regardless of title, they're physicians first. And this was a lesson I learned the hard way. We were working on a value analysis program, and we had a project, and we wanted to change vendors on a particular product line. And we were going to go with a dual source contract. By now you should know what that means. That means we're having 2 vendors deliver the majority of the product for us in that particular product category. And so a lot of people were concerned. They thought that this was going to impact the organization pretty equally across the board, and they wanted to make sure that physicians are on board. So we did a survey with physicians, and we got buy-in, and someone said, maybe we ought to run it by our chief medical officer group. And I had been a part of that group So I said, sure, no problem, I'll bring that in. And I brought it in. I thought this was a slam dunk. I walked into that room and thought for sure I'll get up there and tell them the reasons why we're going to switch vendors, and they'll sign off on it, and we'll just keep moving on. What was interesting, though, is I presented it, and I presented it in what I thought was pretty straightforward manner. This is the potential savings. This is who we're going to sign up for it, and this is when we expect to do it. And we just want your support for this. And there was a huge amount of discussion. I mean, they challenged the data on our surveys. They challenged the data on the costs. I mean, it just one thing after another. And finally, I just said, "Whoa, hang on a second. What is the issue?" And they said, "Well, it sounds like some people aren't going to be happy with this decision." I said, "Yeah, that's true. Some people will not be happy with it, but it's a very, very small percentage of the total physicians. In fact, actually, we have a lot of physicians who want us to change the contract." And so if we don't change it, that group, which is a bigger group, is going to be unhappy. And they said, but right now, if we do the status quo, nobody's really going to complain about anything. And I said, yeah, that's true. And they said, well, we would like to vote. And they put it to a vote. And it was just slightly greater than 50% voted it down. And so I walked out of the room without being able to make the sale. And I was so disappointed. I went back, at the meeting was over, I went back to my office, and I had a colleague stop by, and he said, "Hey, you want to talk about that?" And I said, "Yeah, I do. I mean, I can't believe these guys are going to, that they so quickly just kind of turn that down." And he said, "Terry, I think the problem happened is you forgot their physicians first." And what he meant by that was I came in with sort of a straightforward, almost administrative type of presentation. This is the amount of savings. These are the vendors. These are the dates it's going to occur, and I want you to sign off. It was very sort of quick and straightforward, and they responded pretty quickly to that, and they didn't like that. And so they started asking questions and started challenging it. And he said, all they saw on this was a potential for physicians to get upset. The status quo wasn't going to upset anybody. But if we changed something, some people, even a small percentage, were going to get upset. And when they found out that the CMO group signed off on it, they were going to get upset at the CMO. So that group made a decision, which was, we don't want people getting upset at us, so we're just going to vote it down. And I learned a hard lesson. And so what could I have learned from that? And that is they're physicians first. And let's go through this. What do they value? Well, what's right for the patient care? I did not mention anything about patient care. Now, I didn't think there was going to be any impact on patient care whatsoever, but I should have mentioned it. I should have talked about it. The scientific method. Physicians basically have some basic scientific training in their background. And so I sort of shot out that this was the survey. I didn't tell them how we did it. I didn't tell them a little bit of the details behind it. They're naturally curious about those types of things, and I just completely went right over. I just said the survey showed. They didn't know the methodology behind it. I didn't talk about how this is going to have no impact on quality or patient safety. In fact, actually, if anything, we could use those resources, obviously, to improve quality and patient safety by making a savings on this particular contract, and they were not very impressed with that. The autonomy and independence, and particularly their autonomy and independence of their medical staffs, meaning we were going to make a change and they were not ready for this. And so, what had I done to mitigate those concerns? The relationship with nursing. This was also going to impact nursing as well, and that we hadn't done anything with nursing. We didn't go out and survey nurses. We didn't find out what they thought about it. Kind of interesting, but those are the main things that they value. And I have on here specificity that's unrelated to this particular project, but specificity just has to do with the fact that nurses, as a general rule, tend to be highly sensitive about some types of issues. And I don't mean sensitive in a touchy-feely way. I mean sensitive in terms of they are our guideposts out there. They're the ones who are our listening centers. They're the ones who are out there, the canary in the coal mine, so to speak. They're out there trying to find out where the problems are and making physicians aware of those problems. So they have to be highly sensitive to signals in the environment. And we had not, in this particular one, we had not really talked to our nurses about this change. And they felt that was an important part of the decision. And so physicians, however, are more specific, and that is you bring me a list of observations about a particular patient or about something going on out there, and I'll be more specific about what I think the diagnosis and the treatment is. So these are physician values, and you can see out of that list there, I had violated basically about 5 out of the 6 going into this particular project. And that's what he said to me was, you got to remember they're physicians first. And I had violated those things they valued, even though they're chief medical officers, even though they're all sitting on the C-suites, even though they're considered administrators, they really are physicians first. And so that was the thing that I learned, which was when you're going to approach physicians, always lead with what they value. Don't go in with don't make any assumptions about physicians. Always start with what's right for patient care. We're going to be doing this and we're looking into this. Particular change. We don't think it's going to impact patient care. In fact, we have evidence that it won't. But also, inform them about how you're doing things. Inform them about who you're talking to. And don't forget the other stakeholders, particularly for physicians. Nurses are an important stakeholder group. The last thing a physician wants is to walk in and hear a nurse complaining about a decision that they thought physicians made for them. They really don't need that. They want to make sure that they had a say in it as well. So I learned the hard way, always start with what they value. And that gets them, I think, more interested in what you're willing to say. So if you don't start with what they value, guess what? Just like we talked about in, engagement, which is I started out the discussion with a very disengaging line of approach. I came in with what was, what an administrator probably would find to be acceptable. Physicians, as a general rule, don't. Even though they're trained in administration, they still understand things. They tend to view things as a physician first. And so it's an important one to keep in mind when you're going out and talking to physicians about changes that are happening in value analysis. Think about who they're dependent on, and they're highly dependent on nursing. And so make sure that nursing has bought into something if you're going to make a major change with physicians. Also remember, physicians are always going to, in the back of their mind, they're always going to be asking, how is this impacting patient care? It's that old saying, primum non nocere, first do no harm. Physicians always want to make sure they're not going to be hurting somebody by any change that they make. I always hear physicians are, change resistant. They don't want to make any types of, commitments in terms of change management or anything like that. And what you just have to understand is that we really do function under that first do no harm. That is, we don't want to make any changes that could potentially hurt patients. And so we want to be fairly confident that we're not going to hurt somebody as a result of some changes that we're being asked to make. And so always start with that approach, which is this is what we think the impact is going to be on patient care. This is how we made the decision. This is how it's going to impact our quality and patient safety, and always respect that autonomy and independence, and also understand that relationship with nursing, and also understand they ultimately have to be the ones who make diagnoses. So they're highly specific in what they do. They don't want to have to walk out there and find out there's a problem and they weren't really informed in a way that they could make the best decision for their patient care. So always start with what they value. So administration, expectations are going to vary. It just depends on what role they have in administration. So I'll give you an example. I started in my role and we were just starting up with our value analysis, but I decided to go out and I met with all of our regional leadership, and I asked them what their expectations of me, and also how would they define success 1 year from now for me, meaning what could I do at the end of 1 year that they would say, you achieved success. And what was interesting is they all tended to use the same words to describe what they thought success should be and what their expectations of me. But when I drilled them down and started saying, I want to know specifically what you mean by that, it was all over the board. People had different ideas about even what may sound like something very simple, like we want you to show courage with our medical staff. It's like, okay, tell me what that means to you. And it's interesting. There was this wide range of ideas about what courage meant with your medical staff. And so what I could realize very quickly was had I not asked for that additional drill down, I would have had no idea what success really meant to them. The other thing I realized is that you can make some assumptions about what people think are their expectations of you, but if you don't get them to specify it, it's going to be very difficult to achieve that because, like I said, the expectations vary among administration. They could all be using the exact same words, but they mean different things by them, or frequently, not always, but they typically will mean different things by them. And so, and by the way, this is kind of picking on administration. But I did the same thing with the physician leadership, and they found the exact same thing, meaning physician leadership was also doing the same thing, but more so with administration, at least my impression was, probably because I was working with more corporate administrative folks. So, but I think physicians do the exact same thing. They'll throw out words, and if you don't drill down in terms of what you mean specifically, it's going to cause problems. So this is my recommendation. Define success for them if necessary. Now, some are real good at it. It's amazing. There's certain administrators, when I say, what do you mean by success? They're going to be very specific. They're going to say, Terry, what I mean by success is we're going to see a 5% reduction in costs for impactable spend or something like that. It's going to be really, really, very, very specific. Or in my case, it was we had a strategic initiative, and our goal was to have greater than $25 million savings for the system for that year. And so for them, it was simple. They would just look at me and say, Terry, it's that $25 million mark. You and your dyad partner, the VP of Supply Chain, you both are responsible for delivering on $25 million savings in the next year. That's what success will look like. And so we had that goal 2 years in a row. And the first year we broke the stretch target for it. We had over $34 million in savings. And the following year we had over or about $40 million in savings. So, for that person, we were a success. But for somebody else who defined it a little bit differently, you could see that maybe they saw that differently. Maybe they said, I really expected you to, get a significant savings on orthopedic implants. Well, during those 2 years, if orthopedic implants were not part of the impactable spend, we probably didn't approach it, which was the case for us. And so they may not be aware of the contract calendar, and therefore that becomes a problem for them. And so contract calendar just is just simply that, over the course of any given year, typically when you're approaching value analysis, you'll look at it in terms of contract calendar. So you have to make sure that people understand that, or else they're going to start setting expectations of you that are not very realistic. And so, typically contracts will last about 2 to 3 years. And so if over the next year we're not going to be addressing that particular contract, but somebody thinks that you should, that may not be realistic because it's most likely, very highly unlikely actually, that you're going to go and break a contract just to get some savings. It sends a bad message to the system, and usually because you have so many contracts, it's just because creates increased carrying costs in terms of contract renewals and stuff like that. So I found myself in a situation where somebody had an expectation about specific contracts, only to find out that those contracts weren't even up for renewal later on, and all of a sudden, in their eyes, I was a failure because I didn't address that specific contract. We never had plans to address it, but we did achieve our other goals, which is interesting because you got to get people to really drill down on what success is. I put in there, define success for them if necessary. The reason is because if you find somebody who's getting real vague with you, it's always nice to be able to come back to them and say, let me make a suggestion. If they say, well, I want you to generate some cost savings or something like that. And you go, well, how much? Well, you some cost savings. And you have to be able to come back and say, look, our impactable spend is, let's say it's 25 million, and I think we can probably impact about 80%, or let's say something more realistic. I think we can impact about 20% of that, and I think the overall savings will probably produce about, $1.5 million in savings by the end of the year. And let's just say that's what you tell them, and they say, oh, 1.5 million? Yeah, that sounds like a reasonable number. I would have thought a little bit higher. And you go, okay, how about if we set 1.5 as the target, and we set 1.7 as the stretch target? And if I meet target, it's a success. If I meet stretch target, it's a super success, something like that. But you got to be specific, you got to be realistic, and you have to know your numbers before you walk in that room. So be careful about defining success for them and throwing a bunch of numbers. You don't want to walk in there and say, yeah, we'll get a 30% savings, cost savings across the board in supplies. Well, if you're on a contract cycle of about every 3 years, guess what? Well, 2/3 of your opportunity is not going to become available. Only 1/3 will become available. So you want to be certain that you understand these things before you go in and define success for them. But I do think you have to be specific, and you have to be able to, and you have to hold people to it. You have to be able to sit down a year later and say, remember that conversation we had? We saved $1.9 million in the last year, and you said, 1.5 was going to be target and 1.7 was going to be stretch. I exceeded stretch target, or my team, I should say, exceeded stretch target, because realistically, that's really what it comes down to. It's not like I'm doing it out there by myself. There's a whole team that works on these things, but you want to be able to say our team was able to generate and exceed stretch target for the cost savings for the previous year. Therefore, we are successful, and that's the important thing, because if they're still carrying around unrealistic ideas of what success are, you have to then say, well, remember we agreed that was going to be success, and they have to be able to say, okay, well, what I really meant was, well, then you should have said that. How about we make our next target for next year, and we'll talk about that using your terms, but always narrow them down. Nothing worse than having somebody give you some vague idea of what success is, because the trouble with the vague ideas is that they can be interpreted differently down the road, and now all of a sudden you're working your fanny off for the next year, thinking you're knocking it out of the park, and then they come back and say, well, what I really meant by that was this, and the next thing you know, you're either out of a job or out of a position, or you're scratching your head going, why is this person so disappointed? Because they didn't meet expectations. So get the expectations set early, make sure you define it, make sure it's very specific and also very realistic. And so what do they value? Because you're always going to have to come up with these. I used to always come in with, well, I'll improve quality by X, Y, and Z, and they would come back and yeah, that's okay, I guess. But it's because I realize I have to give them something. I have to put something on the table that they value. They value operational efficiency, fiscal stewardship, and growth. Why do they do that? Because that's their job. That's what they're supposed to do. They're supposed to make the hospital, the healthcare system, an efficient machine for the organization. That's how they do it. Fiscal stewardship, they have to meet budgets. They have to be able to generate some type of margin. Even if you're a non-for-profit organization, you have to generate some type of margin, because margin is what allows you to grow. It's also what allows you to give merit increases and incentives, and to buy new equipment, and to expand your facilities and upgrade things. And so you really have to be able to do that and help them do that, and be seen as somebody who's also working with them. So I would always include some sort of goal that was tied to one of those three values, and make it very clear, this is how we're contributing to something that you value. Also remember, they're going to think that they're always going to assume you understand administration speak. And as a CMO, I can tell you one of my jobs was interpreting between medical staff and hospitals, because medical staff and medical staff speak, and administrators have administration speak, and sometimes they think they're talking on the same plane, and really they're not. They're talking very different terminology with each other, and so you have to learn that language, and you have to be able to speak it. It's not real complex. You just have to be able to. And I think probably you have to be able to just speak up and say, "What do you mean by that?" And I think that people will explain it to you, and when they explain it to you the first time, you'll go, "Oh, now I understand what you mean by that." I remember the first time somebody used the expression budget neutral in a conversation, and it was a conversation with a group of physicians, and one of the folks from administration, from the business office, turned up and said their physicians were making a request for something and wanted to spend some additional non-budgetary money, and the administrator said, I think as long as we can keep that budget neutral, as long as you can find out how we can make that budget neutral, we can approve it. And the physicians walked out, and they're all high-fiving each other. They thought, hey, we got what we wanted. And I walked back, and I said, no, I'm not sure you really understood exactly what they said. They said, as long as you can make it budget neutral. And they go, well, we don't do anything with budgets. We don't do it. And I said, well, they're expecting you to do something. Well, what does that mean? You got to find it somewhere. You're going to have to give up something somewhere. And, well, how do we do that? And it's like, exactly, And so you can set yourself up for a lot of disappointment if you do that. So my job was always to sit in there and go, okay, when you say budget neutral and they have to do it, what does that mean? Well, you're going to have to find something you're going to give up. And so here's the list of things for requests, say, from the operating room. And you're going to have to eliminate some of these so that we can take that money and then use it for the thing that you're requesting. And not only that, you're also going to have to go out and convince the people who we're going to have to tell no to why we're doing that. All of a sudden, everybody, the mood in the room changes pretty quickly. It's like, well, I thought you were going to do that. I thought you were going to find the extra money somewhere. You can get into a lot of trouble with administration speak, and so you have to understand the language, and if you don't understand, ask them what they mean. And if you can't ask them what they mean, go find somebody who knows how to interpret that, because it's going to be very helpful for you to be able to negotiate in the future, not just with your administration, but to set the expectations about what you can and cannot accomplish for your organization. So supply chain services, probably one of the best experiences I had in this whole thing was working with supply chain services. And again, you probably think it's supply chain. Really, aren't those the guys down in the basement that move boxes around type of thing? And first, I got to tell you, the complexity of their work is often underappreciated. I was just blown away by what they do out there. They manage inventory, they manage services, and they manage people, and a lot of people, in fact, because it takes a lot of people to move those boxes around and make sure things are where they're supposed to be. But it's more than that. There was an incredible amount of. I was surprised at the number of people who had graduate school education working in supply chain services. I was like a lot of surgeons. I just thought they were the guys and who basically move inventory around, and that's all they really did. No, not what a complete misunderstanding of what supply chain services does. I told you that earlier. Our organization had 166,000 SKUs, right? 4 to 5 times bigger than your average grocery store that they were managing on a daily basis. And they could not have stockouts in anything. And if they did, they had to find immediate replacement, and they had to notify a large number of people about what that replacement was. Over 2,000 contracts. So we had contracts. There were several contracts that were being negotiated per day in order to make sure that we had the appropriate supplies we needed. They were constantly trying to find what was the best deal out there. They're constantly trying to figure out, is something better in terms of quality than other things. It was really, really, I thought, an eye-opener for me, but also a pleasure to work with, because I learned a lot from them. And I was extremely fortunate. I had a VP of supply chain who was just absolutely outstanding. I mean, he mentored me, he guided me, coached me. He taught me an enormous amount about supply chain services. And it's just an education that I'll carry with me for the rest of my life. So they're just, and the people who work in supply chain are just, they're the salt of the earth. I mean, these are just hardworking, good people. And they really see their mission as being able to make sure that all those services are available and for physicians and nurses to do their job and take good care of patients. I mean, it really is that simple for them, but they have such a complex job on a regular daily basis, and they do it seamlessly. It's amazing, if you do find a time where it's like, we don't have this, everybody gets all upset, and you're like, great, so they don't have the one thing, the one SKU out of the 166,000 that you really needed, but they're going to find it. They'll figure out a way to get it there. And that's the cool thing about supply chain. So number one, start appreciating them. They really are some great people. And as you get to know them, you'll, I think, come to appreciate that more and more. They also have goals, though. Remember, their goals they tend to be focused on cost reduction. They have budgets they have to meet. They have operational efficiencies they have to meet. They're constantly competing internally and externally for all of these. They're looking for new information for all of these in terms of how can they better their services and how can they make sure that they're coming in budget, and also focusing on how can we reduce costs. Like I said, I worked with a team, and in the 2 years we saved almost $35 million the first year and about $40 million the second year. And that, massively beat a lot of people's expectations. And the only reason we did is because I had this absolutely outstanding team that I work with. They will assume, maybe not initially, but eventually they're going to assume that you understand supply speak. And hopefully that I've been able, through this series and this online course, give you an appreciation of some of the supply chain speak that you're going to have to be able to use in conversations on a regular basis if you're going to be doing value analysis. So I think that's going to be a step in the right direction. But just also keep in mind that whenever you're setting goals, whenever you're setting targets, they're probably going to have to be something that involves this cost reduction, something that has to do with their budget, or something that has to do with operational efficiency, because those are really going to be the things that they really have to focus on for the year. It's not that they don't value patient care, they do. I mean, they appreciate it just as much as anybody. But there are things that they have to do for their job that has to be prioritized in their world. So just understand that and appreciate that. So nursing, probably one of the big ones that I ran into was conflict resolution, meaning Nurses are going to expect you as a leader to resolve conflicts. Remember I told you about the whole thing about once you get tagged as a leader, your job is problem solving? Well, nurses are going to take you up on it. They really are. And a lot of conflict that happens is going to be conflict between supplies and nurses' expectations around supplies. So that whole communicating and getting them involved in decision-making process is going to be important. But they're also going to expect you to resolve some conflict at the physician and nursing interface. So there's going to be times when physicians get upset and they don't have somebody from supply chain to yell at. So who do they yell at? They yell at the nurses for the lack of a supply, or it wasn't managed properly, or something like that. Just understand that is going to be your job. You're going to be the one who's just going to have to pick up the phone, call a physician, and say, hey, listen, I want to understand what happened there, and resolve that for them, and get back to the nursing. Let them know that hey, if you have any problems in the future, direct them to me, and I'll take care of it. And that I think will go a long way towards making sure that you're meeting the expectations of nursing. Remember, they also value patient care. Their relationship with physicians is extremely important. And it's amazing how many times, whenever you see conflicts arise, that nurses will back off and want to know what's going on. What do the doctors think? How can the doctors help us? And it's a very tight working relationship that develops over years, sometimes decades. And so you have to respect that. Like I said, they value sensitivity. So they're really out there trying to gather information and they don't want to miss any patient who's taking a turn for the worse. So they really do have to gather a lot of information. They really do have to, and sometimes, hit the bell and say, I think we got a problem here. And they're going to call upon a physician. And that's why they have this tight relationship with physicians, because the physician now has to come in and be the specific one and figure out from all the data they've gathered, is there really a problem here, or is this something we can sit on for a while? It's important to understand that relationship, because it's such a tight working relationship that you as a leader have to respect it. And so when you're making decisions about supply chain and supplies and value analysis, keep them in mind and understand that because of that tight relationship, they're often going to be sharing information with each other. So you want to make sure that your messaging is the same for nursing as it is for physicians. Also understand that most nurses are employees. So they're going to be given administrative objectives. Administration is always trying to accomplish new things, whether it's with the budget or it's with various types of new models for nursing or something like that. So they're challenged with a lot of that stuff, and you have to realize that they have other objectives because they value their patient care and the relationship with physicians, but they may be given goals that are set by administration or by their directors. So you want to be able to understand what those goals are and align your goals with theirs. Knowing how nursing management is incentivized is extremely important for your success. You want to be able to talk to them and say, what are you being asked to accomplish this year? What's the most important thing that you want to get done in your unit or in the operating room or in the cath lab or wherever it is? And how are you getting, you don't have to necessarily know anything about, whether they're on some incentive plan or anything like that, but you want to make sure, what are your top 3 goals or something like that? And how do I align what we're doing value analysis with one of those goals, one or all of those goals? Because you're more likely to get a lot of assistance with that. And anytime you can make that alignment, it's amazing how people will help you. And that's the nice thing about it is you shouldn't have any secrets about this stuff. You should just simply say, these are the list of projects we're thinking about working, which ones will work with you, because we'd like to get your help on this as much as we can help you with your targets and your objectives. So that's a nice tight working relationship that you can continue with them in order to make sure that your program has success. So your value analysis committee, and actually this ends up being one of the most challenging of your stakeholders, and the reason is because you've got everybody at the table. And so you're balancing all these competing expectations of all the groups at your meetings. And so you really, at that level, you really got to get everybody focused on, a common interest. If you try to meet everybody's expectations in those meetings, you may find yourself competing against one another, and you don't want to do that. So the best thing to do, this is what I found, is find something that everybody can agree on. And usually data is a pretty good starting point. And so data a lot of times can inform, but I think it can also bring people together, because now when people start to see data, they start to understand some of the problems that the organization is confronting. And when they see data, they may look at it, well, my department has a problem with this, but boy, compared to what, the entire organization is facing, that's relatively minor. And that, wow, I could see how helping you guys out with this other thing is probably going to be really more important for the short term. So it's always a great way to kind of make sure people are informed. I like risk adjusted and benchmark data. Now for supply chain, it's a little more difficult to get risk adjusted data. That's usually more in the quality area and patient safety. But benchmark data is out there. Find out what your organization is doing. Are they working with ECRI or one of these other organizations that can provide data on benchmarking? I think it's going to be helpful for your decision making. You want to know sort of what others in your position are facing in terms of the pricing information. Now, your supply chain folks should have this down. In fact, actually, if they don't, then somebody needs to wake them up, because this is part of their job, and they're generally pretty good at this. Particularly the contracts folks, they're going to be looking at that data. They're going to want to know what other people are doing in that particular product area, and so they are always looking for a better deal, and they're always looking for a reason to have a better deal. So benchmark data is actually a great way to do it. So talk to them, learn from them, try to make sure that everybody else is seeing the same thing. And the nice thing about benchmark data is that when you get pushback from somebody saying like, well, I think we should just pay the vendor what they ask for. It's like, well, wait a second. There's 4 vendors in this space. One of them, or 2 of them, or whatever, are asking for a price point that is clearly outside the range of fair market value. How do we just always reward everybody who asks us for a ridiculous price and just give it to them? And unfortunately, in the past, a lot of times that has been done just to sort of keep peace in the family, particularly among physicians. But I think it's important to be able to go back to physicians and be able to explain to them that concept of the benchmark data, because fair market value is just that. You don't want to get a reputation. You certainly want to get a track record of being somebody who's always paying more for something that everybody else is paying a lot less for. Once you get that reputation out there, they're going to be like, wolves all over you. There's no way you're going to be able to shake that one. And so the only way to do it is to just stick with some sort of objective measure and being able to negotiate in good faith with what is truly fair market value for a product's pricing. The thing is you're not out there trying to undercut anybody. Remember, the vendors have to make money too. So we're not talking about going in and having them sell things for less than it costs to produce them. We're talking about making sure that they get a little something for their margin. There's nothing wrong with that. But we just don't want to have it be ridiculous. We want it to be something that obviously other people are paying, but also something that rewards them for their hard work and the research that they put into developing their products. So there's nothing wrong with negotiating and with that in mind. And to me, that's negotiating in good faith. You're both understanding, the hospitals understand that the vendors have to make some money, and the vendors understand that the hospitals have to save some money. And so you find some point that you're able to work within, or some range of points you're able to work within, and then come down to making a decision on a particular price point. And that's important for your success of your program. And the more you get a reputation for doing that, the more likely vendors are going to approach you with that approach. And so it's nice to be able to finally get some respect from the vendors, and also the vendors like to know that they're getting some respect in return. It's not, they're the evil empires out there that need to be made out to be sort of the bad guys and all this. So the other thing is, remember, as your program grows, the priorities of the program will change, and the people will change. And so as programs grow, they take on new projects and new types of priorities for the organization. And as your organization grows and develops and matures, and your program matures with it, your program has to change. And it's not uncommon that the people will change. In fact, actually, I can guarantee you the people will change, even if your program doesn't grow. But most likely your program will mature, and as it does, you want the people to be there to take care of the program. And so with that, I want to talk on a little bit about succession planning. And you might be wondering, why is it under leadership? Because to me, it's really up to leadership to make sure that there's a succession plan in process for you. So what is it? It's a process for identifying and developing people with the potential to fill key positions in the program. And I just took this off of Wikipedia. It's not to be confused with replacement planning. That's basically, hey, Joe just quit, or we're gonna need somebody to fill in here. and you're just putting a warm body in position. How many of you have been in the operating room and all of a sudden, somebody goes on break and someone else replaces them, and it's like, okay, they haven't been trained up on this room, and you're like, that's a replacement. That's not succession planning. That's not somebody thinking about who's going to be in that position when that person's gone. This is a process that has to start early. You have to think about it as you're building your program. And so we'll go in, and I'm going to walk you through this, just some key steps. I do have a separate succession planning course that I've done for robotics. It's very similar in process, so if you want to go, that one's for free. You can watch it. I think it's in less than an hour, about an hour long or so, but it walks you through this whole process of succession planning. Everything you see for the robotics program, for the most part, will be very similar to what you would do for a value analysis program. So if you're interested, please visit that one and take a look at it. But I think succession planning is going to be really key for you. So first off, identify who owns the process of succession planning. If you have a C-suite, there's probably someone in your human resources who is in charge of talent management. And so they're already looking at succession planning in the C-suite. Why? Because they really can't afford to have C-suite members leave and not have somebody to replace them fairly quickly. They don't want to do these external searches because those are very expensive, and they don't want to have to start grooming somebody who isn't really quite ready for it yet, because that's also expensive. But the idea is you want to know who's going to own it. And unfortunately, for a lot of robotics programs and for value analysis programs and other types of programs, the problem with it is that you no longer have HR doing that job, because it's not really their job. It's not like they're trying to find somebody for the C-suite. They're trying to find somebody for your value analysis program, but a lot of people on value analysis programs may not even work for the hospital, so they're probably not going to do that, be my best guess. And so somebody has to do it. So who owns it? It's the leadership. Whoever the leader of the value analysis program, you own it. You should be looking for who's going to replace the people who are currently on my team if something happens. So identify the key roles, and I think I've done that for your program and talked about the competencies of the people who are going to be in those roles, because you want to be able to make sure that somebody's going to be there in case that person leaves for whatever reason. So you want to have potential candidates. And I always found the nice thing you can do is you look at everybody who's a member of your value analysis program and on your committee and say, if you weren't here, who could replace you? Because you want to have a designee process. Say, name a designee. Who would be the person, if you went on a month-long vacation and you couldn't be here for the next few meetings, who would be there? And so you want that person to say, well, I think so-and-so would be a really good candidate because they pretty much know my job, but they just need to show up at a few meetings to get a sense of how this works, and they'd be a good person to fill in. That's a nice way to get the process started. But you really should have this mapped out. I would just sit down and say, who are all the people on the committee? Who's their designee? And if that person didn't work out, who would be someone who we tap for this particular role? And also coordinate this selection with management. I made a mistake one time is I had somebody who I thought was really an up-and-comer. She was outstanding, was a nurse, and I wanted to give her some more leadership role in a particular committee that I was working on at the time. And I just happened to mention that to our chief nursing officer, and she just, her face just went pale. And she just looked at me and said, no, I don't think that's a good idea. And I said, why not? And she said, because of something else unrelated to the committee. She was going through a corrective action process, and they were in the process of effectively firing her. And so I didn't know that, and so it's good to go talk to your management, because sometimes somebody may shine in a committee but may have problems in other parts of the organization. And you want to make sure that management's okay that you're going to be promoting somebody or giving somebody some leadership opportunities. So being able to do that and coordinate with management will save you that embarrassment of promoting somebody who just got fired, So I also think providing critical developmental experiences is important. So I learned this one the hard way too, and that is I found somebody who I thought would be a good leader for a particular program we were working with, and this is non-value analysis, but it was another program, and brought the person in and said, hey, could you run the committee for me? I'm going to be late. And I just had something, I had to be somewhere else for about the first 15, 20 minutes. And he said, yeah, sure, no problem. And I got there, and they hadn't covered anything. And I said, hey, I thought you were running the agenda. I thought you were getting the committee. He said, well, I told everybody, let's just wait till you got here. And I thought, oh, man, no, And so I had to sit down with him, and this is the next step, which is and give him feedback on his performance and say, hey, listen, when you take over, when you take the reins, I expect you to run that committee like it's your own committee. You know, that's an important point. It's like, hey, if, when we get into this position again, you're going to run it. You're just going to go through the agenda and start looking at things. And if you want my feedback on stuff, just ask me later on. But do not hold up that committee, because that's not what your job is. When you're a leader of that group, you have to lead. And so you just have to give people feedback on that type of performance. And the other thing is pick a succession date. When you find somebody and you're like, I know this person is going to be, their person who's going to take over. Pick a succession date and communicate it to all your stakeholders. Say, if you're particularly for a leadership position, if you know you're going to come up with a new physician leader of your value analysis program, it's time to come in and say, on this date, the person who was previously here is we're going to retire, and Dr. So and so is going to take over, and he'll be taking over as the new physician lead for our value analysis program. And so you just want to make sure that everybody's aware that you've chosen somebody and when you chose them. I had a situation once where I showed up. I was made a medical director somewhere, and I walked in, and everybody was looking at me going like who are you? And I just finally I had to went to the nursing head, and I said I'm your new medical director. And she said, really? Because nobody told us about that. And wow. We ultimately, it was kind of interesting because we ultimately ended up working it out. We had a great working relationship after that, but that first day was a little rocky because they didn't know. No one gave them information about who I was or what I was supposed to be doing. I just showed up assuming that they'd all been informed that an announcement had been made, but no announcement had been made, and I pretty much had to make the announcement myself. And it was kind of an awkward position to be in. I always made it a point to say, I'm never going to do that to another leader. I'm just going to always make sure. Now, have I been 100% successful with that? Not always, but I try to make my best effort to make sure that people are informed of whenever there's a change and when it's going to happen and who's coming in and why I picked them. So it's always important to communicate that. So as always, you can get a hold of me. Questions, you can contact me through my email or through the website, and let me know what you think. And also, if you have any questions, I'd be happy to field any questions, and I'll get back to you as soon as possible. Until then, you're about ready to move on to the final last section. It's performance improvement. And I got to tell you, it's probably one of my favorite sections of this entire course. So I'm looking forward to it, and I hope you are too. So have a great day, and thank you very much.